everyone, this is DrBisma MD MPH, and as I promised, I am back today with another very important health related video, and the topic is thyroid disorders in women, and because it can affect women of any age in any reproductive stage. So I chose this topic because I thought it will be really a great topic for discussion. Few points before we jump to the discussion. So first of all, the purpose of these videos I am making is only to raise awareness and empower all women belonging to any race, religion, color, or any other different group. Another very important point I would like to mention is these videos are not intended to serve as a substitute for your primary care physician's opinion, medical advice, or treatment. So again, just consider these as a resource for your knowledge, for your loved ones' knowledge. I would also like to thank everybody, my friends, my followers at different social media platforms that have been extremely supportive and expressed tremendous love and encouragement and motivation. So thanks to everyone once again. Subscribe to the channel, my YouTube channel, and if you like the video or even if you dislike the video, please leave your valuable feedback so that I could improve and I could include the topics which you like. Okay, let's start the discussion. So what is thyroid gland and why it is considered so important? Thyroid gland is a small butterfly-shaped gland that sits right here at the base of the neck. It creates or produces or secretes thyroid hormone or secretions that are then transported through blood to different parts of the body and the systems. Thyroid hormones regulate our metabolism. They literally regulate the function of each and every cell in our body, and also they control our heart rate through different various effects on cardiovascular system. Why it is considered so important again? Thyroid disease or disorders are very common in women. Roughly 1 in 8 women in their lifetime may go through any type of thyroid disorder. So how many types of thyroid disorders are here? There is hypothyroidism, which is very common, and again it is common in females. There are several types of thyroid disorders, but the most common is hypothyroidism, which means thyroid gland is not functioning properly. It is functioning slow and it is producing lesser amount of the hormone than normal. The other type is hyperthyroidism. Hyperthyroidism means thyroid gland is hyperactive and it is producing excess amount of thyroid hormone. There is thyroid nodule, which means there may be solitary nodules or lumps in the thyroid gland. Also, there is goiter. Lastly, there is thyroid carcinomas. There are various types of cancers. Today, my purpose is to discuss various types of signs and symptoms that are common in females, and they also are common in males. So I would like to discuss a few important signs and symptoms that are found in females. Starting from puberty or childbearing age, women can have disturbance in their menstrual cycle, monthly cycle. So today I would like to discuss few signs and symptoms, general signs and symptoms that are common in males and females, but then I would also like to discuss few signs and symptoms which are very specific to females, and they can cause to infertility through various mechanisms. In hypothyroidism, there may be intolerance to cold. There are some GI symptoms including constipation or diarrhea, or there is increased appetite. There may be weight gain, especially in hypothyroidism. There may be weight loss despite increased appetite, usually common in hyperthyroidism. Also, in hypothyroidism, the skin becomes dry, coarse, and thick. There may be thinning of hair and alopecia, which means that there may be bald patches in scalp. Also, if we do a blood work, there may be hypercholesterolemia, which means that cholesterol levels will be really high. Disturbances can produce various types of menstrual cycle changes in women of childbearing age. Their menstrual cycle could be disturbed from regular to irregular. Even it can stop, or there will be a gap in the periods. It is called amenorrhea or cessation of the periods. The blood flow could be really little, or it could be excessive. Besides that, thyroid hormones can affect ovarian hormones, causing lack of ovulation. And if there is a complete lack of ovulation, and we call it AnOvulation, it can cause infertility issues in women, which is very common. Thyroid hormones also can cause premature menopause, that is, cessation of the menstrual cycle, cessation of the periods before the age of 40, instead of regular or usual age, average age of being in 50s. During menopause, thyroid hormones can present as premenopausal symptoms, and sometimes osteoporosis, which is a which is considered a sign and symptom of menopausal age, and it is also common in thyroid disturbances. They can combine together, and it can present as osteoporosis or breaking of bones, thinning of bones. So one has to be very vigilant during menopause. Women need to get their hormone levels checked. Thyroid hormones can also present with a number of complications during pregnancy, whether it is hypothyroidism or hyperthyroidism. Both conditions can affect mother as well as baby, and there can be serious growth retardation or growth problems. I would like to produce another video for addressing thyroid disorders in pregnancy, because hypothyroidism or hyperthyroidism both can be really complicating situations for both the baby and the mother. So please stay tuned, and if you like the video, as I said, subscribe to the channel so that you will get the notification as soon as possible. Thank you and have a great day.